My focus is to guide you as a patient through the ways of transformation to reconnect with yourself.
Most surgeons focus on how you look after surgery. Dr. William Bukret focuses on how your face holds that result. With more than 23 years of experience and a background in complex reconstructive surgery, his approach to facelifts is designed for safer, longer-lasting results.
I'm Dr. William Bukret from Buenos Aires, Argentina. I'm double board certified plastic surgeon with 23 years of experience. And my focus is to guide you as a patient through the ways of transformation to reconnect with yourself. I mainly specialize in facial plastic surgery, deep plane surgery, and I have my MECHA facelift procedure, which is very particular, laser facelift, and minimal invasive procedures, facial procedure. First, we get the information, and when we get the information, we're going to go for 3D simulation, and we're going to go with a consultation, virtual consultation, and we're going to check all your needs or whatever is necessary until you feel safe and you get all the information and everything is in place in order to create, your treatment plan, personalized, customized, and that's exactly what we're going to do. And that way you feel you are under control of everything. Sometimes the people ask, as early like in 30s, start asking for some facelift procedure. And for example, there are older patients that ask, I'm ready for doing a facelift. Yeah, of course you are. Because, there are many different techniques that we can use. For example, we can use an upper endoscopic facelift only if you want to tighten up a little bit your eyebrows or your gaze a little bit more open and refresh. And that can happen early in the 30s. And also we can elevate, a little bit the cheeks here in patients that the middle 30s too, with the minimal invasive laser facelift with no scars around the ears. We go from there to more extended, which is MECHA, multiplanar extended advanced techniques, where you're gonna go through all your neck to the chest to rejuvenate everything when you need it, of course. Surgical procedure can vary from 2 hours to sometimes 8 hours. It can be long lasting like that. Yeah, it can be like that. Yeah, depend the patient and the particular features. It will depend primarily the preparation. That's why it's so important the predictive medicine here, because be prepared, taking the medication necessary or the supplements, the vitamins, everything in order to be prepared for the surgery. That's primarily important. In that way, we can reduce with the techniques and all the planning, the recovery time. Faster, that can be 1 week or 2 weeks for most of the cases. The more common side effects are some swelling, some bruising, some sensitivity issues like some kind of lack of sensibility in this area, particularly around the ears. That's pretty normal. And sometimes it can be some little asymmetries in terms of swelling or movement, and that's important to notice during the first 2 or 3 weeks. Okay. And in terms of complication, hematoma is the more important complication, even though it's not so common, because in terms of in general, hematomas around about 5% in our hands, and most of the time it's a minimal hematoma, something that you can evaluate and evacuate under with a punch, aspiration. you do an aspiration in our office under the guidance of ultrasound, and you can easily solve it. Most of the cases. Sometimes it will be necessary to go back to the operating room, but that's rare. That's rare complication. Normally 2 weeks, 3 weeks, depending on the areas we're gonna address.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.